APGO Educational Topic Number 59, Introduction to Osteopathic Principles in Obstetrics and Gynecology. This second part of the video will discuss the different types of osteopathic manipulative treatments commonly used in women's healthcare, including high velocity, low amplitude, muscle energy, myofascial release, osteopathy in the cranial field, and strain and counterstrain. These osteopathic manipulative treatments will be demonstrated and discussed by Dr. Anita Showalter with osteopathic medical students Hilary Baer and Aaron Deprickle. High velocity, low amplitude.
When preparing to do high velocity techniques, it's first important to do a structural diagnosis to find out what segment is in need of treatment. So the structural exam includes examining the tissues to see areas of tension, bogginess, restriction in motion, any tissue texture changes, and stroking the tissue can bring out a red reflex that shows an area of dysfunction. When an area of dysfunction is identified, then we need the segmental diagnosis. So pressure is placed on the transverse processes to see which way the vertebrae is rotated.
Okay. Erin, can you please go ahead and bend forward?
Then flexion and extension is done to see the position of ease of the vertebral segment.
Yes. So T5 is extended, rotated right, side bend right.
Okay. So now we position the patient for treatment.
Go ahead and cross your arms.
The object of HVLA is to have a small thrust that will move the segment only about a 1/16 of an inch. So it's a small distance with a quick thrust. So the hand is placed to rotate the vertebrae left since it's rotated right. Head is lifted to isolate the segment.
Okay.
Patient takes a breath and lets it out. Then a short, quick thrust is applied.
Okay.
After the treatment, the patient is re-examined to make sure that the treatment is successful. Also, it's important to warm up the tissue prior to doing the treatment, that usually happens just with the structural exam and the manipulation of the tissues to examine. Okay,
Much better.
Successful treatment.
Myofascial release.
Now we're going to demonstrate a myofascial technique, and this will be both direct and indirect techniques. When the operator is checking the tissue, the object is to see if the tissue is moving symmetrically, side to side, cephalad, caudad, and rotationally. If there's an area that the tissue does not seem to move as freely in, to use a direct technique, the hands will push towards that area that does not want to move as freely and hold it until a release is felt and there's a tissue texture change to show that the tissue is moving more freely. For indirect myofascial release, the tissue is pulled away from the tension so that the tissue can relax. When a release is felt, which usually is 20 to 30 seconds, then the tissues recheck to show that there's more motion, more symmetry of the tissues. Times when this technique might be used is patients with abdominal pain, patients that are post-surgical, The technique can help to reduce edema and overall tension and pain.
Muscle energy.
After the treatment, the patient was re-examined, and it appears that there is a second area of dysfunction, now more prominent since the first was fixed.
Okay, so T6 is flexed, rotated left, side bend left.
Okay. Now let's use a muscle energy technique to show a different approach to a similar thoracic problem. So the operator has control of the upper body, and the dysfunctional segment is now placed in a direct fashion the way it does not want to go.
Okay. All right. Now, Erin, I have you positioned in extension, rotated right, side bend right, and if you could please try to straighten up gently.
So the patient uses their own muscles to resist
And relax.
the operator's effort. When they relax, the operator will take them more into the appropriate position.
Okay, and go ahead and rotate. And relax. Big breath. Okay, and one more time.
And this action is repeated several times until the affected vertebrae can be brought against the barrier to give an increased range of motion. Again, after treatment, the patient is rechecked to make sure that the treatment was successful with improved range of motion of that segment.
Cranial treatments.
Cranial treatment is a highly specialized treatment in the osteopathic library of techniques. A lot of people wonder if there can actually be any motion in cranial sutures. What we know is that the sutures are plastic in the living human being, unlike in a dry bone where the sutures would be more like plaster. So wherever there are sutures, there's a beveled edge that allows some motion like this around that suture. We believe that it's the flow of the cerebral spinal fluid that causes the expansion and contraction of the skull, and also in the spheno-basilar junction. Spheno-bone is right here, and this is the base of the skull. You also get a beveling motion, anterior-posterior, that is flexion, extension. So when the head is flexed in the spheno-basilar junction, you will get a widening and expansion of the skull, and when it's extended, you will get elevation and stretching of the skull. These are very subtle, but with advanced palpatory skills, it's possible to feel them. So the vault hold that is normally used would be placing the hands over the vault of the head to feel as much of the surface of the skull as possible, and then note that expansion, contraction, which I'm exaggerating with my hands so you can see it. We're going to go ahead and demonstrate how this looks on a real person. To perform cranial treatment, the operator should be seated comfortably at the head of the table with the hands in the normal vault hold, very gently addressing the skull. One notes if there is motion with that expansion, contraction, very subtle. And the operator uses their hands with a very light touch to move with that motion. When the motion is not very dynamic, individual sutures can be treated by spreading. It's called a V-spread technique. So, in the temporal area, fingers can be placed on either side of the suture with gentle pressure.
Counterstrain.
The next technique we'll demonstrate is counterstrain. Counterstrain is a technique designed to improve tension in the tissues. So a patient is checked until they find a tender spot. Often the tender spot is found in the belly of a muscle. And this is demonstrating an abdominal tender point. Then the patient is positioned by folding the tissue over the tender point. So in this case, flexing the hips and knees, and then side bending until the maximum relaxation of the tissue is noted and the patient has the maximal improvement in the pain with palpation. Okay, so at this point, she feels the tissue is most relaxed. The operator will hold this position for approximately 90 seconds, monitoring the tension in the tissues, and when the appropriate position is found, there will be a pulsation in the tissues that's a clue to the operator that this is the right position to get relaxation.
Erin's pain was initially a 7. In this position, it is a 0. I feel the pulsation. I'm returning her to neutral.
Patient is slowly returned to neutral, again continuing monitoring of the tender point. Then the tender point's rechecked.
She tells us that her pain is much better.
Excellent. A successful treatment has about 70% improvement in the initial pain.
Somatic dysfunction can be addressed by these techniques as well as by others. Successful treatment improves range of motion, symmetry, and reduces pain, and treatment may also affect homeostatic factors that improve visceral function and promote a state of health. Osteopathic treatment has been shown to improve daily function in pregnant patients with low back pain, improve hemodynamics, and decrease complications of pregnancy. Osteopathic treatments have been shown to reduce the need for pain medication as an adjunct after gynecologic surgery, and it can be used as an integrative approach for women with chronic pelvic pain. This concludes the APGO Introduction to Osteopathic Principles in Obstetrics and Gynecology. We have briefly introduced the history and definitions of key terms including somatic dysfunction, structural exam, and osteopathic manipulative treatments.